The most important thing to know is that perinatal mental disorders are very common. They can affect about one woman in 4, one woman in 5, and that they can be very varied in their presentation. The reason is that pregnancy and then delivery and the early postnatal period are possibly one of the biggest, if not the biggest test for the body and the mind. And that means that the likelihood of any illness, not just psychiatric, but any illness occurring is higher in this time of life. Diabetes, high blood pressure, back pain, any kinds of problems can become more acute or intensify during this period. If there's a little crack, it probably wedge open during the perinatal period. That's also true for mental health problems. So anxiety disorders and mood disorders can become worse. Eating disorders can become worse, especially in the postnatal period. We know now a lot more about the terrible impact of trauma, and particularly in this context, birth trauma. A very common disorder that a lot of people know about, which is a common complication of pregnancy, is postnatal depression. And that sometimes is not so easy to recognize because some of the symptoms can be confused with the early stages of having a baby. People think, well, if I'm not sleeping, I'm not eating, I'm forgetting, I'm tired all the time, my memory is all mixed up. They think that maybe it's just because they've got a tiny baby and it's the childcare that does that to them, and it might take a while to recognize that actually something's not quite right. Some of the symptoms are very difficult to talk about because they're so difficult, like not feeling a connection to one's baby, or not being able to feel joy or pleasure in being a parent, and all of that can be extremely painful, and it is very difficult to go through. But it is very important, if that happens, that women talk about it with their doctor or talk to a specialist. A lot of other symptoms can be on a spectrum with normality. It's very normal to feel that mood goes up and down in the first few days. That's something that happens to 8 in 10 women because of hormonal changes. It's very normal to feel more anxious and more easily alarmed. And those are experiences that most new parents have. The question is, when do those anxieties and fears and changes in mood become so overpowering that they cloud the whole experience? And that's perhaps when people need to start wondering whether they should talk to someone about them. If they increase rather than melt away. There is also a less well-known, because it's less common, complication of pregnancy that can be quite acute and sudden. That's called postpartum psychosis. So I would say, in conclusion, that if there's anything that makes you feel worried, especially when you're pregnant, you don't have to wait until you've had a baby, but if there's anything that makes you feel worried about how you're feeling or what you're thinking, it's really important to get some advice. Talk to your doctor. Go to a specialist if that's what you want. It's much better to understand your own worries and possibly be reassured that they're perfectly okay worries to have. But if there's something else there going on, then you can get the care that you need sooner rather than later, and that's really important.